Hello, my name is Dr. Gerald Harris, and I'm going to be talking to you today about the use of platelet-rich plasma and stem cells in the treatment of musculoskeletal pain. You've probably heard about platelet-rich plasma, and that's what we're going to discuss now. Platelet-rich plasma is exactly what it sounds like. It's a solution that's very rich in platelets. Where do we get it? We get it from your own blood. Your own blood products then go back into you. There are many pain problems that don't need to be treated with surgery. People who have pain, which is called soft tissue pain. For example, people who have trochanteric bursitis in the hip, tennis elbow, Achilles tendonitis, low back pain, neck pain, joint pain, others. What if we could trigger a healing response to be initiated in these people so that their body could heal itself without the surgical intervention? Well, about 15 years ago, some people did pioneering work in regard to the use of platelets to stimulate the tissue healing that's just given up. And it worked. The platelets are a part of the blood that's principally responsible for starting the healing process. And they're basically just little bags filled with growth factors that float around in the blood. The platelets are the reservoir in your bloodstream of these growth factors. The substances like platelet-derived growth factor, which is very creatively named, and it was the very first one ever discovered. But there are a large number of other growth factors in the platelets that promote healing, and some that promote differentiation of stem cells as well. And also there are other growth factors in the blood and in the local tissues. There are colony-stimulating growth factors which cause those then differentiated stem cells to grow into normal tissue for the repair of local area of involvement. When the blood flows through the injury site, the inflammatory chemicals released by the injury trigger the platelets to release these growth factors into the injury and start the healing process. In order for these platelets to effectively restart the healing in an area that has given up on healing, they need to be given in a much higher concentration to the injury site than they would normally be found in the blood. So how do we do this? Well, what we do is we draw blood from you and put this blood into a machine that separates the platelets from the rest of the blood, and then concentrate the platelets to about 6 to 10 times their normal concentration. For a typical specimen of PRP, it will contain about 12 billion platelets. We then load this purified and concentrated platelet solution into a hypodermic syringe and inject it directly into the damaged soft tissues where the pain is coming from. This can be done under ultrasound guidance or by the so-called peppering technique to the tender area, or it can be done under fluoroscopy. The injection itself can be somewhat painful. However, we usually mix numbing medications in with the platelets, so the injection site pain is brief. After the numbing medication wears off, the person will usually be quite sore. Typically, people are very sore for the first 3 to 4 days after the injection. We don't want you to use any anti-inflammatory medications, however, like cortisone, non-steroidal anti-inflammatories, either over the counter or by prescription, for about 1 week before the procedure and for about 5 weeks after the procedure. That would include Aleve, Motrin, Advil, ibuprofen, Celebrex, or any number of anti-inflammatories that are available on the market. These appear to affect the way the platelets function, as well as interfering with the healing process. About a week after the procedure in most people, the pain goes away from the injections. It usually takes from 2 to 6 treatments to obtain a cure, with an average of about 3 treatments in most patients, performed at about 6 to 8 week intervals. For diagnosis which otherwise would be very difficult to treat, PRP treatments can often be highly effective. Sometimes the platelet-rich plasma isn't enough to do the job by itself, and it's necessary to utilize adult stem cells. Adult stem cells can be obtained either from the patient's fat or their bone marrow. The stem cells from fat are greater in number, and they retain their viability with age, whereas the stem cells from the bone marrow tend to be fewer and less viable with age. So, for most applications, fat-derived stem cells are more desirable. Also, most patients seem to be a lot more willing to give up fat than they are bone marrow. How are these fat stem cells obtained? We do a mini liposuction, usually from the patient's belly. Other areas of the body where there are thick enough fat deposits can also sometimes be used as well. We usually suck out about 60 cc's of fat and then process this fat to remove most of the oil and the water from it, leaving a material that is rich in stem cells, which is then mixed with the platelet-rich plasma, which nourishes and directs the development of the stem cells to do what repairs needed to be done. This mixture is then injected into the damaged areas. When would one want to use stem cell PRP in combo instead of just the PRP by itself? Stem cells are most useful in situations where something is missing as opposed to just damaged. This is most commonly encountered in situations where the cartilage coating of a joint has been completely ground off and the joint surfaces are bone on bone. If there's even a thin layer of cartilage lining left in the joint, then it can usually be salvaged with just the PRP by itself. But if the cartilage is completely missing, then there's nothing left to salvage. The stem cells then act to help restore the cartilage coating of the joint. The stem cells also find use in severe connective tissue injuries where there are gaps that need to be filled in, and also in labral tears in joints. Usually it is only necessary to use the stem cells in a given area once. Then it is only a question of how many follow-up platelet-rich plasma treatments are needed to complete the healing process. I hope that this answers some of your questions today. If you have additional questions or need further information, then feel free to contact our office and talk to our friendly and informative staff. Thank you for your time and attention in watching our video.